Most people have no idea that pancreatic cancer is one of the deadliest cancers we face today, quietly catching up to, and in some countries surpassing, breast and prostate cancer in mortality. It doesn't get the headlines, it doesn't get the awareness walks, yet it's claiming tens of thousands of lives every single year. Here's the terrifying part. Pancreatic cancer is often called a silent killer because it hides deep inside the body with vague, easy-to-ignore symptoms. Even today, the overall 5-year survival rate remains painfully low. Only a small fraction of patients are still alive 5 years after diagnosis. But there is a small window of hope. Research shows that many early symptoms appear 3 to 6 months before diagnosis. That means there is a brief, precious window where noticing the right combination of signs could literally change someone's future. Have you or someone you love been noticing strange new symptoms that just don't feel right, but you've been brushing them off as age, stress, or digestion? In this video, we're going to talk about 8 surprising warning signs of pancreatic cancer. Some are so common and vague that most people never connect them to something this serious. But recognizing even a few of these early clues, especially when they show up together, might give you or someone you love a life-saving head start. Welcome to Senior Health Secret, the channel devoted to helping adults 55 and older stay informed, empowered, and proactive about their health, with clear, compassionate, science-based explanations. I'm Dr. David Kaplowitz, MD, and I've spent much of my career caring for older adults who were blindsided by serious conditions they never saw coming. Pancreatic cancer is one of the toughest. It often doesn't scream for attention, it whispers. And because those whispers look like normal problems, indigestion, fatigue, back pain, people delay seeking help until the disease is much more advanced. My goal today is not to scare you, but to equip you. You're going to learn what the pancreas actually does and why its location makes early cancer so hard to detect. 8 key warning signs that may appear months before a diagnosis. Why patterns matter, especially when several of these show up together, when it's time to stop waiting and watching and call your doctor. This video is educational and not a personal diagnosis. But what you learn here could help you ask better questions, seek earlier evaluation, and maybe even save a life. Your pancreas is a small flat organ tucked deep in your upper abdomen, behind the stomach. It has 2 huge jobs. Digestion. It produces enzymes that help you break down fats, proteins, and carbohydrates so your body can absorb nutrients. Blood sugar control. It makes hormones like insulin that keep your blood sugar in a healthy range. Because it's buried deep inside the body and surrounded by other organs, tumors can grow there for quite some time before they cause obvious, sharp pain. Early symptoms are usually indirect. They come from disturbed digestion, blocked bile flow, inflammation, or pressure on nearby nerves and organs. That's why we have to pay attention to subtle, persistent changes, especially when they're new, unexplained, and gradually getting worse. Let's walk through 8 warning signs you should know. 1. Digestive problems and greasy, pale stools. One of the pancreas' main tasks is to release enzymes that break down your food. When a tumor blocks the pancreatic duct or reduces enzyme output, digestion becomes less efficient. Common warning signs include ongoing nausea, queasiness, or vomiting, bloating, or a heavy feeling after small meals, a noticeable drop in appetite, unintentional weight loss over weeks to months. A very important clue: changes in your stool. When your body can't properly break down and absorb fats, stools may look pale, clay-colored, or greasy, float or stick to the toilet bowl, have a strong, foul odor that's different from normal. People often dismiss this as something I ate or just my stomach acting up. But persistent digestive changes, especially pale, greasy stools plus weight loss, should always be discussed with a doctor. 2. Deep, persistent fatigue and weakness. Cancer cells are extremely demanding. They steal energy and nutrients from the body, and your immune system uses extra energy trying to fight back. This can cause a different kind of tiredness, a deep, crushing fatigue that doesn't match your activity level. Feeling exhausted even after what should be a good night's sleep. Simple tasks, walking across the room, climbing a few stairs, carrying groceries, suddenly feel unusually hard. This isn't, "I stayed up too late," tired. It's relentless, doesn't improve with rest, and may be accompanied by low mood, irritability, or trouble sleeping. Fatigue is common in many conditions, but when it's new, unrelenting, and paired with other symptoms on this list, it deserves a closer look. 3. Recurrent fever, chills, or night sweats. Pancreatic cancer can trigger inflammation in and around the pancreas. This can confuse your body into reacting as if it's fighting an infection. You might notice fevers that come and go without a clear cause, episodes of feeling very cold and shivery, followed by feeling overheated or sweaty, night sweats where you wake up damp or soaked, even when the room isn't hot. Unlike fevers from a typical virus, which usually improve in a few days, these temperature swings may persist or keep returning. They can also be linked with jaundice or bile duct blockage, which we'll talk about in a moment. If you're having unexplained, repeating fevers or night sweats, especially with weight loss or abdominal discomfort, it's worth getting checked. 4. Unexplained blood clots, especially in the legs. One of the most overlooked warning signs of pancreatic cancer is its effect on blood clotting. This cancer can make the blood more likely to clot, a state called hypercoagulability. That's why some patients develop blood clots in the deep veins of the legs, called deep vein thrombosis, DVT. Warning signs of DVT include swelling in one leg, or occasionally both, often in the calf, warmth, tenderness or pain in the swollen area, skin that looks reddish or bluish. The true danger appears if part of that clot breaks off and travels to the lungs, causing a pulmonary embolism. Symptoms include sudden shortness of breath, sharp chest pain that gets worse when you take a deep breath, rapid heartbeat, feeling lightheaded, or about to faint. These are emergency symptoms. While blood clots can have many causes, unexpected clots, especially when combined with weight loss, fatigue, or abdominal issues, can sometimes be an early clue to an underlying cancer, including pancreatic cancer. 5. Swelling of the gallbladder or liver. The pancreas sits near the bile duct, which carries bile from the liver to the small intestine. When a tumor in the head of the pancreas presses on or blocks this duct, bile can back up. This can lead to enlargement of the gallbladder, sometimes detected on an ultrasound or CT scan, swelling of the liver, occasionally felt as a firm fullness under the right rib cage, early signs of jaundice. We'll touch on this more with dark urine. You may not feel this swelling yourself, but your doctor might pick it up during an exam or imaging test. When a patient has unexplained liver or gallbladder changes plus other symptoms on this list, it can be a crucial clue pointing toward the pancreas. 6. Constant gas, bloating, or feeling. Unusually full pancreatic tumors can interfere with digestion and also press on nearby structures like the stomach and intestines. This can cause frequent bloating or a tight, swollen feeling in the abdomen, a sense of being full after just a few bites, early satiety, mild nausea that doesn't seem tied to specific foods. What makes this worrisome is its persistence. This isn't the occasional bloating after a big meal or gas from a specific food. Instead, it keeps coming back day after day. Often doesn't respond to antacids or simple diet changes, may gradually worsen over several weeks. Persistent unexplained bloating or fullness, especially with weight loss, appetite change, or pain, should not be ignored. 7. Deep tummy or back pain. Pain patterns can give important clues about pancreatic cancer. When a tumor forms in the body or tail of the pancreas, it can create a dull, deep ache in the upper abdomen, often central or slightly to the left. Pain that radiates through to the back, sometimes like a band wrapping around discomfort that worsens after meals or when lying flat. Some people notice it feels slightly better when they lean forward. This is not the sharp, cramping pain of a typical stomach bug. It's more like a gnawing, constant pressure that lingers and gradually becomes more regular and intense over time. Because back pain is so common, this symptom is easy to dismiss. But new, persistent upper abdominal or back pain, especially in someone over 50 with weight loss or other signs on this list, is something doctors take seriously. 8. Dark yellow or brown urine, early jaundice sign. Your urine can sometimes reveal trouble before your eyes or skin turn yellow. When a pancreatic tumor blocks the bile duct, a substance called bilirubin builds up in the body. Normally, bilirubin is processed by the liver and exits through stool, which is why stool is brown. When that pathway is blocked, urine becomes dark, deep yellow, tea-colored, or brown, like cola. Stools may become pale or clay-colored. Over time, the skin and the whites of the eyes can turn yellow, jaundice. You may also notice itchy skin without a clear rash. If your urine suddenly becomes dark and stays that way despite good hydration, especially together with pale stools or itching, this is not something to watch for weeks. It needs prompt medical attention. Pancreatic cancer is often silent, but as you've just seen, its impact is anything but silent. The real danger is not only the aggressiveness of the disease itself, but how easily its early signs can be dismissed. It's just my digestion. I'm just getting older and more tired. It's probably stress or something I ate. Yet for some people, these small symptoms are the body's quiet alarm system, trying to warn that something serious is happening deep inside. Will every case of bloating, back pain, or fatigue be pancreatic cancer? Of course not. But when several of these symptoms show up together, are new for you, and keep getting worse instead of better, that's when you owe it to yourself, or to someone you love, to speak up and get evaluated. Sometimes the difference between too late and just in time is simply how quickly someone decides to take their symptoms seriously. If this video helped you understand the hidden warning signs of pancreatic cancer, don't just click away and forget it. Pay attention to your own body. Write down any symptoms that concern you, especially if they're persistent. Share this video with family or friends who may be ignoring little problems they've had for months. And if you'd like more clear, compassionate explanations about serious health conditions that affect older adults, make sure to follow Senior Health Secret and turn on notifications so you never miss an important topic. I'm Dr. David Kaplowitz, MD, and this is Senior Health Secret, where we believe that knowledge, awareness, and early action can change the course of your health. Thank you for watching. Take care of yourself, and remember, sometimes simply listening to your body is the most powerful step you can take.